lady in scrubs and a turtleneck, and she would be willing to listen. And I think that quality, more than anything, active listener. And no matter how busy she was, and I know she was busy, she would have the time to listen and be supportive and answer questions. And there are still questions. I really would like to have a hotline to say, oh, it was. So for me, I think that one quality was that ability to listen with compassionate care. And if I could be half as compassionate, half as good a listener, and half as humble as she was, I would be a much better person. So if anybody would like to share another memory.
My name is Cynthia Fisher, and I am here today as a representative of St. Margaret's Hospital Guild. Dr. Graham was a recipient of the Achievement in Medicine Award in 2002. This is an award given by the Guild each year to a person in the medical profession who has shown outstanding dedication and achievement. And I think that perfectly describes Marilyn Graham. The short time that we knew her was truly a gift to us, and she will be missed by so many. She will be remembered as someone who created excellence through the love of her work and those she served with a very gentle and gracious spirit.
My name is Carla Keeper, and I was the secretary. And I just want to share this moment. Her journey has just begun. Don't think that her is gone around. Her journey has just begun. Life moves slowly fast. This birth is on the walk. Still the curve is rescued from the sorrow and the tears, and they place warmth and comfort where there are no days and weeks. Think of how she must be wishing that we could know together. And nothing that I said was he really passed away. But think of her as a living, think of her as living in the hearts of those she touched. For nothing was ever lost, though she was lost so much. And I just wanted to share this also. I received a call from a patient today. She's been a patient for about 13 years. And she just wanted to express how
Sherry, I know how difficult that was for you, but I can't sit here without saying something from the Women's Visit Center. She always would answer our calls, no matter how many times we called her. She calls back. She would somehow show up at the Women's Visit Center just to say hi. Or she would ask us, "Are you having any problems today?" And of course we'd say, "Yes, please help us. Can you do this?" And it get done. She is the one that has went to battle for us when they wanted to close the Women's Visit Center and say that we weren't needed, like many others. But she would stand up and fight for us. She is so meek and so mild, and you think she's so sweet. She can't do anything. She can't fight those battles, but she did. She'd come into a delivery room and everything would just calm down. And she'd put your hand on someone's shoulder and you'd instantly stop shaking and think, "I can do it. It's going to be all right." She would be greatly missed. Thank you for sharing my notes. But it took a lot of time from you for her to be so devoted to us.
I had the privilege of being with Tanya on February 24th when she delivered her daughter with Dr. Graham. And Tanya's asked me to share this with you. She didn't think she could. I'm thinking maybe I can't either, but we're going to give this a shot. These are Tanya's words. "I became a Wishard employee 3 years ago. At that time, I had asked a coworker for a doctor that she would recommend. My coworker advised me that Dr. Marilyn Graham was one of the best at Wishard. During the 3 years as her patient, I had the best, most knowledgeable doctor that I could possibly ask for. Dr. Graham was a very patient person and would take her time with each patient she had. 12 months ago, I received the most exciting news of my life. I was pregnant. Now my husband and I have the most beautiful gift in the world, our daughter, Marissa Rain. She is now 3 months old and the most precious gift any one person could ask for. I could not think of anyone better than Dr. Graham to be by my side throughout my pregnancy. Although she will not be there for our next child, I will never forget her advice and wisdom throughout the years."
I'm Suzanne Young. I'm one of the 9 women's health nurse practitioners that work very closely with Dr. Graham, or I should say she worked very closely with us, because like the Women's Visit Center, she was so supportive of us for the last 12 years that I've been here. I know all 9 of us are so grateful to have been able to spend time with her. When we first started as a group, she would come to meetings like on a regular basis, and we wrote protocols together. I mean, she just was with us every step of the way. One time I remember when the Center of Hope opened, that was one of the programs that Dr. Graham kind of envisioned and nurtured, and it was just one of the many programs that she did that with. But when they had their opening day, I felt a little strange, and I said, it'd be nice if the OBGYN department would maybe send flowers or something. And I thought she would arrange that. And she hand carried a basket of flowers over that she had gone out and put together. And I just thought, that's so typical of Dr. Graham. She didn't delegate very well. She did things herself. anyway, she was totally the best, and we're going to remember her forever because she's left so many wonderful programs in place. Thank you.
I'm Peppi Peterson, and I can't remember exactly when I met Marilyn, but it was in the early 90s sometime. But I just have to tell you, a spider just jumped on me a few minutes ago, and I thought, oh, that's it. Marilyn was the weaver. She was the weaver of our patients and all of the programs that touched our great patients, and she touched all of us. And was always supportive of everything we tried to do to support our patients. And I just feel like we can take that support now because we're all going to need it and support each other again.
Marilyn's husband, Michael, has asked for the opportunity to say a few words.
I'm Michael Graham, the other Dr. Graham, and Michaela's other parent. I appreciate you all taking time to remember Marilyn. I was with her 20 years ago this March in an auditorium in Norfolk, Virginia, when she opened this envelope that said Indiana University School of Medicine OBGYN residency, and we looked at each other and said, Indianapolis? Because we have about the level of knowledge of Indianapolis just about everyone else does who doesn't live here. You say, I'm going to say a word, and you say back to me what you remember. Indianapolis, 500. And that was, all she knew about Indianapolis was the program that she had ranked high on her rank list, and so we came to Indianapolis. We didn't know at the time that we would finish raising our family here. Michaela is Marilyn's third-year project from her residency. Actually, some of it took place during the second year of her residency, but Michaela has been actually a lifelong project and a delight and a ray of sunshine. We didn't know at the time that we came here that this would be where Marilyn, if you will, made her stand as a physician, teacher, and apparently, as I helped clear several thousand emails out of her mailbox in the last 10 days, a program developer also.